very important question in today's time, because today we are at a stage where some basic investigations are available at every hospital, which can be so easy to get that you just have to go and say mujhe ye test karna hai and it will be done. So it is as simple as that. So first I will talk about the preventive tests, then I will come about the vaccine. So two of the cancers in women which can be easily prevented by screening test is one which is breast cancer, which is worldwide the most leading cancer amongst women, and second is cervical cancer, which is the most leading cancer in India and in developing countries. These two cancers can be picked up in their pre-cancerous stage before they turn into cancer. So that's why they give us so much time to treat them. Cancer होने से पहले ही you can detect, शायद हो सकता है, तो you can start the treatment immediately. So the test for breast cancer would be, first and foremost, if you have a family history, if your mother or atya or some close family relative, mother's sister or mother's mother, grandmother, some close first degree family relative has history of breast cancer, then you should get your screening test done from the age of 35, which is just a basic mammography. It is nothing but an X-ray and sonography of the breast. So this can be done yearly or 2 yearly depending upon what your doctor suggests and how much risk you have. You can do this. This will easily pick up any early changes before it spreads or before it becomes difficult to treat. Second, worldwide test that is used is a simple pap smear test. Pap smear is for cervical cancer, that is cancer of the mouth of the uterus. So this mostly occurs due to an infection by human papilloma virus. I'm saying mostly, it does not always occur due to that. Mostly it occurs due to human papilloma. There are other causes as well, but human papilloma is the most common preventable cause. We can prevent it. So pap smear test is a very simple thing in which a brush is used and just the cells are touched on the cervix, that is mouth of uterus, and sent for testing. So that is so good that it needs to be done only once in 3 years. The new liquid based smears, they have to be done once in 3 years from the age of 25 or from the time you are sexually active. You can keep doing it and it prevents or predicts cancer 10 years before. You can know that shayad mujhe ho sakta hai. So right from now you can be cautious or whatever necessary treatments. Not always uterus removal is not the option. Other treatments are there which do not require surgery, like which I will enumerate later on. There are simple steps in which you can just remove that much part and keep monitoring whether the infection that pap smear changes has reduced or no. Second, there is apart from pap smear, there is something called as colposcopy, which is just a small microscope or a video microscope fit into a video, and it is used to magnify the cervix and seen on a TV. And you can use different dyes like acetic acid, iodine to apply on the cervix to see any simple color changes. So many international governments and now even Indian government is training its Anganwadi workers and basic social workers to screen this in normal public. It's very simple. They just have to apply the dye and see whether color changes. They have to refer them for testing. So this also picks up in pre-cancerous. So I want every woman to at least get one pap smear done in their lifetime, because that has itself shown to reduce the possibility of cervical cancer by 30%. So even one test if every woman does in her life, it is very beneficial, and I hope this message I can take to as many people as possible.